This talk is an overview of the diagnosis of eating disorders. This talk will review the diagnoses in the chapter of the DSM titled Feeding and Eating Disorders, with a visual organizer to help you remember the criteria. Specifically, I'll talk about anorexia nervosa and its two subtypes, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. There are 5 symptoms that distinguish these disorders: restrictive eating, binge eating, purging, low weight, and body dysmorphia. Restrictive eating refers to anything done to limit eating or lose weight, and may include dieting, fasting, or even excessive exercise. Binge eating refers to episodes of overeating associated with a sense of loss of control. Purging often refers to self-induced vomiting or promoting food excretion through other means such as abusing laxatives or diuretics. But purging can also refer to any compensatory behavior used to make up for the excess food intake, including fasting or exercising. This can make it a bit tricky to distinguish from restrictive eating, but the distinguishing feature here is whether or not the purging behavior is preceded by a binge. In other words, whether or not the purging is done to compensate for a binge. Low weight simply refers to a significantly low weight for the person's age and development. Practically, a BMI less than 18 is considered low enough to meet this criterion. Finally, body dysmorphia refers to a disturbance in the way your body weight or shape is experienced, or an extreme influence of your body weight or shape on your self-esteem. For example, this could manifest as an intense fear of weight gain, dissatisfaction with your body, or an inaccurate perception of your body. Now that we've defined these symptoms, let's discuss the criteria for each disorder one by one. Anorexia nervosa has 2 subtypes, the restricting type and the binging and purging type. In the restricting type, the patient restricts their eating due to body dysmorphia, which leads to a low weight. In the binging and purging type, the patient repeatedly binges and purges due to body dysmorphia, which leads to a low weight. As you can see, the common features between these subtypes are the low weight and body dysmorphia. Therefore, these can be thought of as the core symptoms of anorexia, and distinguishes anorexia from the other eating disorders. Next is bulimia nervosa, which involves repeated episodes of binging and purging associated with body dysmorphia. Unlike the binging-purging subtype of anorexia, in bulimia, the patient's weight is normal or overweight. In binge eating disorder, the patient has repeated episodes of binge eating, but without the compensatory purging behaviors seen in bulimia. Finally, avoidant restrictive food intake disorder, commonly known as ARFID, is distinct from the others and somewhat of a catch-all diagnosis. It refers to any pattern of avoidance of eating due to any reason. Common reasons include lack of interest in eating, a sensory aversion to particular aspects of food such as smells or textures, or concern for consequences of eating, such as a fear that they will vomit after eating. To meet criteria for ARFID, this avoidance of eating needs to be associated with at least one of 4 consequences: weight loss, nutritional deficiency, need for nutritional supplementation such as with a feeding tube, or functional impairment. These are the common eating disorders. I've listed these diagnoses in order of severity, as measured by all-cause mortality. Mortality rates in anorexia are 4 to 14 times as high as the general population, while the rate in bulimia is 2 to 8 times as high. These high mortality rates are due to both medical complications as well as high rates of suicide attempts. Mortality data on binge eating disorder is less available, but short-term follow-up studies show that remission rates are higher in binge eating disorder compared to anorexia or bulimia. Since ARFID is a relatively new diagnosis added to the DSM in 2013, there's not enough data yet on prognosis. Let's conclude by briefly outlining a few other less common eating disorders you should be aware of. Atypical anorexia includes all the symptoms of anorexia, except the patient maintains a normal weight. Pica involves persistent eating of non-nutritive substances such as paper, soap, or metal. Some forms of pica can be due to underlying nutritional deficiencies, such as repeated eating of ice and iron deficiency. These nutritional deficiencies should be ruled out first. Finally, rumination disorder involves persistent regurgitation of food, then rechewing, reswallowing, or spitting out the food. Underlying gastrointestinal diseases should be ruled out first. That's the end of this talk. I hope this is a useful guide to these diagnoses. Thank you.